Hi, my name is John, the Millennial Therapist, and welcome back to my channel, where I offer professionally informed perspectives on all things related to talk therapy. Today, I'm going to discuss what I believe to be one of the most commonly misdiagnosed mental health conditions in America today. I'm going to make what some people might consider a few controversial claims here, but after years of clinical experience, including in inpatient settings, I'm pretty confident when I say that about 90% of the time or more, when I come across a client with this diagnosis, it's absolutely incorrect. Honest mistakes, I'm sure, but mistakes nonetheless. I will also broadly review the DSM's criteria for this diagnosis while exploring some of the reasons I think this happens. Please remember that all of these videos are for entertainment and educational purposes only. If you are looking for a personal therapist, YouTube is not a place to find one. Okay, let's get started. The diagnosis I'm referring to is, of course, autism. Now, in the current DSM, this diagnosis is referred to as Autism Spectrum Disorder, or ASD. And it has 3 levels of severity based upon the amount of support the diagnosed person requires to manage in life. Level 1, requiring the least support, and 3, the most. Fundamentally, autism spectrum disorder is about persistent, lifelong, clinically significant interpersonal deficits and rigid cognitive behavioral patterns that can make socializing very difficult and gravely impact activities of daily life, or what we call ADLs. This can include things like taking a shower or grocery shopping. Many people, including clinicians who should know better, look at the criteria for ASD and check off a bunch of boxes that feel applicable superficially. Unfortunately, they do this without realizing that all actual clinical diagnosis must be done both differentially, that means ruling out other explanations, and with an eye to materially evidenced impairment, not mere subjective complaints. Now, there is a wide range of functional interpersonal behavior among human beings, and true ASD, even at level 1, is noticeably far from it. When interacting with a person who has true ASD, a person does not just think, this guy is socially awkward, introverted, or shy. The person thinks, does this guy realize I am talking to him? Or what is happening right now? This dude's responses, or lack of response, might actually be making me uncomfortable. Many people with ASD might even resemble an individual with an intellectual disability, and indeed, these conditions frequently overlap. One problem is that almost any introverted or socially awkward person, if not careful, could label himself with ASD. Many people will recognize themselves in these traits, but diagnosis depends on an overall pattern, developmental history, and degree of impairment, not simply a subjective review of the DSM criteria. A quick, though not official test of whether a person likely has ASD would be self-sufficiency. If a person doesn't require any level of minding in his or her life, and they have some kind of social life, then ASD becomes very unlikely. Keep in mind also that many diagnoses can explain elements of social awkwardness. So then why all the misdiagnoses? Okay, why is that happening? That is where things get both interesting and a little controversial. I want to be clear that I do not know for sure. I haven't done any tests or studies. I'm not basing this on any huge meta-analysis, but I do have ideas and opinions that I am prepared to share. I think ASD has skyrocketed in diagnosis for a few reasons. The first is the most obvious: privileges. It might sound strange to say, but if a person can swing a diagnosis like ASD, he or she might then qualify for accommodations that grant an advantage. This is especially evident in academic settings. Extra time on tests, homework, personalized support, and generally more patience with one's behavior across the board are just a few examples. The second is also obvious: money. I'm not sure how many of you are aware of the term medicalization, but it refers to when a non medical, commonplace human experience is medically commodified, or in other words, labeled a medical issue so that it can be justifiably solved with medical or behavioral health interventions. That, of course, generates a lot of money for people in related fields, including therapists. ASD doesn't go away, it's a lifelong treatment, or rather, something that needs to be treated over the course of a person's life. The third is a little less obvious, but I think people have started to notice it: identity. We live at a time when many people collect identities as a means of social capital, allowing them to participate in both grievance politics and identity politics and to opt in or out of more or less favorable groups of people. ASD is a popular and frankly easy to obtain diagnosis that achieves these ends seamlessly. Should a person find herself without a desirable political community with which to ally, or worse, labeled as part of a problematic group, an ASD diagnosis excuses them. It can act as a get out of jail free card socially. The fourth cause is just classic avoidance. When people feel like they do not fit in somewhere or are awkward, different, or just not as talented as others at a given thing, they might look for an explanation that relieves them of the responsibility to change or accept circumstances. I once had a friend who I had known for 2 decades say to me one day, "I finally figured it out, John. I know why I'm so introverted and awkward around people and struggle to make friends. I have autism." Surprise, he did not have ASD. He was, as he said, just introverted and a little awkward. What he did have, however, was a desire to avoid leaving his comfort zone, and a diagnosis allowed him to relinquish that responsibility and put the blame on forces out of his control. Fifth, because of the stigma associated with an intellectual disability, many parents and people prefer an ASD diagnosis. In our credential, status, and talent obsessed society, many people would rather their child or loved one or themselves be labeled as autistic, as having ASD, as opposed to intellectually challenged. ASD has been associated with hidden talents like eidetic memory due to such films as Rain Man. The reality is, most people with ASD have no such capabilities. In any case, I personally believe that many individuals who are intellectually challenged receive an ASD diagnosis because it makes family members more comfortable. Sixth, and finally, there is, in my view, an obvious decline in the standards of American behavioral and mental health practice, leading to fast, loose, and lazy diagnoses, which inevitably select for the most well-known conditions like ASD. It is also important to remember that the criteria for ASD are easy to research and emulate for a short period. In many cases, there is no evidence beyond self-reporting required to support that assertion that a person has had lifelong symptoms. An hour-long one-time assessment is sufficient in many cases, not all, but many. There are, of course, more comprehensive assessments that might include a specialist with hours of questionnaires and testing, but frankly, I've seen even these miss the mark by a mile. A lot of conditions in the DSM are difficult to diagnose on the basis of book or theoretical knowledge alone. Many clinicians simply do not have experience with actual cases of ASD. Instead, they are vaguely familiar with people the public politely calls neurodivergent, an obvious euphemism, and work from that template. It can be a little like surgery. It is one thing to be book smart in the way of surgical operations, and another to have actual material experience and exposure. You need both to be effective. This is true of many mental health diagnoses, which I will explore in other videos. Thank you for watching. Be sure to like and subscribe, and check out more of my videos.